liver disease, which requires international collaboration. In recognition of its urgency and in response to the rising prevalence of health risks and diseases among children, both here in the UAE and across the globe, the elite pediatric gastroenterology workshops over in the capital today aim to encourage international partnerships. According to experts, this will help provide doctors with a platform for the exchange of knowledge and best practices. Organised by the Sheikh Khalifa Medical City in collaboration with the North American Society for Pediatric Gastroenterology, Hepatology and Nutrition, also known as NASPGHAN. The event, in its second year, brings together 300 regional and international physicians, nurses and dietitians. Among the topics this time around is liver transplants. At present, the SKMC in Abu Dhabi is handling 25 paediatric liver transplant patients, a significant number compared to the rest of the region.
Well, some of it's genetics, some of it's anatomical problem they are born with, like children who are born with an abnormal drainage of the liver, causing serious GI liver disorders. Because to provide the best care for our children, we have to stay in touch with the latest advances in healthcare. Many of our patients receive their care at a tertiary care center like Sheikh Khalifa Medical City. To stay upbeat and state-of-the-art activities, we have to stay in touch with major research centers around the world, like Cincinnati Children's, Harvard Medical School, and many other institutions.
The three-day event will have 25 speakers focus on nutritional disorders, case studies, treatment management and care. Dr. Athos Bousvaros, an associate professor of pediatrics at Harvard Medical School and president of NASPGHAN, also spoke about inflammatory bowel disease, an area of active research and advancement.
We in Boston follow approximately 1,100 children with these diseases. It's a very large number. But lately we've been realizing there's a very large increase in inflammatory bowel disease in very young children, those under 5. And in those under 5, there's a very strong genetic and immune component. And many of the patients that we're seeing are being referred by countries like UAE and other areas. And so I think one area of partnership that we need to develop is medical care of these very young children with inflammatory bowel disease. We can identify the genetics, we can identify the bacteria that may cause them, and we hope that we can also develop new treatments. I think there are a number of very important diseases that we all need to partner with. These include common diseases like diarrhea, viral illness, malnutrition, dehydration, vitamin deficiencies. These are common. We in Boston tend to deal with rarer diseases, things like diseases of the immune system, immune deficiencies, Crohn's disease, ulcerative colitis, liver disease, and metabolic disease. All of these need additional research, and all of these need improved health care.